Actually, natural birth does not always mean a vaginal birth. Natural birth means, of course, having a vaginal birth, but without any interventions, which means that you could have a vaginal delivery with interventions like inductions, you could have an instrumental delivery, you could have a small cut, while the delivery happens. By natural birth, we mean that, a vaginal birth without any assistance of these kinds, nothing artificial. Now, let me talk about vaginal birth versus cesarean section. Of course, if the vaginal birth happens naturally, it is even better, because your labor is shorter, probably less painful, and sometimes associated with less blood loss also. But when we talk about vaginal birth versus cesarean section, overall, if you compare an uncomplicated vaginal delivery with a cesarean section, the risk to the mother is much lower. Risk of excessive bleeding, risk of infection, risk of postpartum hemorrhage, sometimes blood clots in the legs. So all these risks are minimized probably 6 to 7 times, and the risk of even death is much less. But of course, that does not mean that a difficult vaginal delivery can always be advocated, because in certain situations, to do a cesarean at the right time is the most sensible thing to do. Having said that, what is really important to understand is that if one has a vaginal delivery, reasonably uneventful, one recovers faster, one bonds with the baby sooner, one has better chances of breastfeeding, exclusive breastfeeding. So overall, the experience of being a mother is much easier if you have a vaginal delivery. This is of course the medical part of it. That is, some people whom I hear these days, some of the expectant mothers, they tell me, my mother had a cesarean, my aunt had a cesarean, none of them had a problem. Why, doctor, are you telling me all this? See, when you talk about problems about a particular individual, particular patient, you are looking at a very narrow or a telescopic vision. When we talk about risks and recovery and all this, we talk about thousands and millions of women, and whatever we are saying is all evidence based. It is something which is published in the literature, everybody talks about it. People who have absolutely government basis of health sector like NHS in UK, they will always advocate a vaginal delivery, because they know that overall it is so much safer compared to a cesarean section. The other part of it, other than the medical part, there are other parts of it also. What is really important to understand is that birthing is basically a natural phenomena. Just like a woman has to go through the menstrual phase in her life, she goes through pregnancy. And because these days we have tried to kind of control nature in different ways by not getting married at the right time, by not having children at the right time, we try to modify these natural aspects to some extent. Basically, pregnancy is very much physiological. 80 to 85% people will not have complications. A small percentage of women will have, and it is our duty to detect the problems and to act early. But most women will not have. It is not that most women will have. That is the paradox, Most women who come to us with a normal pregnancy think that they will have a problem, but most women don't have. And it is a great experience to have. It is like, it's like some kind of an empowerment. Women who deliver naturally, who do it themselves, a lot of them will tell me that they felt a different kind of empowerment which they never had before. I will give you the example of a woman who delivered normally, who was suffering from obsessive compulsive neurosis, and she was, every time she talked about this with me while she was pregnant, she was told, her friends told her she could never do it, her parents' mother told her she could never do it, and she would come and talk to me in every consultation and say, I can't do it, it's not possible. And I used to spend hours with her, and I said, you never know, you could go in spontaneous labor, you could have a short labor, and you may deliver very easily. And finally, after she delivered, she told me that this was the best experience she had, and she had so much confidence in herself that she felt as if, a lot of her anxiety problems she has overcome because of this experience. She did something which everybody around the world thought she couldn't do. So it's a kind of a achievement, which only a woman can do. And she has to have the confidence. The problem these days is that we are losing confidence in our natural abilities. And we feel we can't do this and we can't do that. We fail before we even try. So I think there comes the role of doctors, nurses, paramedical people who are trained in this, and we need to bring the society back on the path of natural childbirth. There are other problems with C-sec. Pain is a problem sometimes which persists. Even doing exercise sometimes takes a little longer compared to a normal delivery. Breastfeeding is another issue, because you see, when you exclusively breastfeed, then you get back into shape faster, which after cesarean section sometimes takes longer. So these situations are there. See, if one plans to have more children, more than one, then having a vaginal birth is even more important, because with every subsequent pregnancy, the risk of having some medical problem because of cesarean section will go up many-fold, to the extent that there is a condition where the placenta in the future pregnancy can get stuck to the cesarean scar, and it can lead to massive hemorrhage and severe maternal morbidity and mortality. So if one plans to have more than one child, then it's even more important that one tries for vaginal delivery, and even after one cesarean section, one could try safely in a setup where all facilities are available. As far as beauty and physical sense is concerned, the physical comfort of a mother, because there are some studies these days which say that the pelvic tissues get lax, and the future problems in having relation with the husband may not be so satisfying. You see, the question is that nature is wonderful. After 6 weeks of childbirth, usually a lot of the tissues and all the changes that have happened in pregnancy will come back to its natural state. The only thing is that sometimes one has to exercise, one has to do some natural like having a good nutrition, doing good exercise, physiotherapy. All these things may enhance your tissues and body to come back to shape. But I don't think that it is always true that after a cesarean you don't have those changes, and after a normal delivery you have more problem. So basically one needs to get fitter, one needs to actively participate in physiotherapy and exercise to get back into shape. Other than this, some mothers do say that after a vaginal delivery one has more chances of stress incontinence, like when you have urinary incontinence and these problems. But I don't think these problems are very common, and even if they happen, usually they are not that incapacitating, and they can be managed with routine exercises. There are some studies which are coming up in a big way which says that going into labor is not only good for the mother if she has a vaginal birth, but going into labor is very good for the baby also. And it has been seen that babies who are exposed to those stress hormones that the mother secretes during labor, they have some adaptive changes on the baby's body which improves the baby's immunity. So baby has less problems of bronchial asthma, diabetes later in life. So there are many studies which are now advocating that even if you have to do a planned cesarean, do it in labor. You see, which is like very important. A lot of mothers, tell me, I bore the whole of labor and then you did a cesarean, what is the use? And I tell them it is good for the baby. You see, labor is good not only for you if you have a vaginal birth, but it is also important for the baby. The Muhurat cesareans, a lot of people don't understand, is medically not advocated because of several reasons. One reason is this, like I told you, baby is not exposed to the hormones of labor, the stress hormones of labor. Secondly, when you do a cesarean section without a medical indication, less than 39 weeks, the baby will have more respiratory problems because the lungs of the baby are not squeezed in the vaginal birth. So it is not good for the baby. Of course, an elective cesarean section without an indication is not good for the mother. Like we told you, it's a major surgery, higher chances of infection, bleeding, etc. Muhurat, you see, Muhurat cesarean section just means that we are doing it on a particular time, on a particular date, and we are doing it without a medical indication. So obviously it is not something which one should go for at all, because when basically birthing is a natural phenomena. We cannot make it artificially happen on a particular day. It's not good for the mother, it's not good for the baby. The baby may not be ready at all. Basically birth needn't be medicalized, you know, we have to keep it natural. And to some extent we are medicalizing it because we are weighing the risks and benefits, you know, like in the past many times everybody knew that the first birth was very risky, so they would think, okay, even if something happens to the baby, it doesn't matter, it's okay, the mother will have a normal delivery, the subsequent birth. Of course we cannot think like that, because here every baby needs to be saved. So there we always sometimes have to intervene, but then that has to be weighed looking at the risks. We can't do it indiscriminately. Of course, I would consider my doctor's role first, and I will say that medically speaking, vaginal births are safer for the mother, less infection, less bleeding, less risk of morbidity, less risk of mortality. Number two is that vaginal birth is very good for the baby. Like I told you, the hormones which are secreted by the mother have great adaptive changes in the baby. Baby has lesser chances of developing infections and certain diseases later in life if the mother has had a vaginal delivery. Number three is that when you have a natural childbirth, it is good for breastfeeding, it's good for your recovery and the bonding with the baby. And it's a great sense of achievement. It is some kind of an empowerment. It is not as painful and as uncomfortable as most people think, because nature itself makes some pain hormones, pain relieving hormones. If we go the natural way, a lot of the things can be solved in a natural way. Most important, last but not the least, is that if one is planning for more than one child, then this becomes even more important, because the future pregnancies are at risk of placental problems, extreme infection, ruptured uterus, if one has cesareans one after the other. See, the thing is that what we tell our mothers is that when you are a first time mother and when you are delivering with us, we would expect that 80 to 85% of you should have a normal vaginal delivery, and somewhere around 10 to 20% will not. Okay, and we cannot say who will be in that 10 to 20% category, but if one mentally, physically prepares oneself, then the chances of being in that 85% category will drastically increase. I think the counseling bit really helps, and it has helped our mothers. I still feel that a lot of the mothers are prepared for vaginal delivery, not because of they don't think so much, it is just that, you know, in the family everybody promotes a vaginal delivery. But the percentage of people who want a cesarean is increasing, and increasing very fast in the urban sector. So we are seeing better results. We are spending more time with the mothers whom we know will, you know, tend to go for a cesarean, like IVF pregnancy. We are not going to advocate a cesarean section just because she is having an IVF pregnancy, but we may have to spend double the amount of time with her to convince her of the advantages. So definitely we are seeing a positive shift, and we are talking about, you know, we hold these labor workshops where we are only discussing about the importance of having a vaginal delivery.